Welcome back. In today's video, we are going to study about the indicators of health. It is a continuation of a chapter, Concept of Health and Diseases. Indicator. What is an indicator? Indicator is a variable which is giving us an indication of a particular situation or the reflection of that situation. So what is an indicator? Indicator is which with that gives an indication. Health indicator is a variable, a susceptible to or a direct instrument to the direct instrument which is reflecting the state of health of the person in the community. Since it is an health indicator, what is the health indicator doing? What is it indicating? It is indicating the health. It indicates the health of the persons in the community. Indicators will help us to measure the extent to which the objectives and the targets of a program are being attained. What is the use of this indicator? It's just one of this use here. What does it do? It helps us to understand the effectiveness of a particular program. For example, a 5-year plan. Let us consider the 5-year plan, or we can take the Alma Ata Health for All by 2000 plan. Now here, how effectively was the target being met? These indicators of health will help us to determine how well our project has been implemented, what is the progress, what is the loss, and everything. So what is an indicator, guys? You understood what is an indicator? Indicator is nothing but a variable which is giving us an indication of that particular situation or the reflection or the result or the outcome of that situation. So we know what is an indicator. Now let us see what are the various indicators of the health. Health status indicators will measure the different aspects of the health of a population. Like we read, what does the health indicators do? They will help us to study the health of the population. Examples will include the life expectancy, infant mortality. What are the various aspects which come under the health status indicators? What are those factors which are indicating the health of the population? The life expectancy of that population. The infant mortality. Mortality is nothing but the death, disability, or chronic diseases rate in that community. These are the health status indicators. Some of the examples they have given. Moving on, health determinant indicators. What do you mean by determinant indicators? They measure the things which are influencing the health. Now you see, direct measure of health is these life expectancy. We get to know how many years will the person live. What is the infant mortality? These are nothing but the health status indicators. Now there are certain factors, okay, A, B, C. These factors which are indicating the health are nothing but the health determinant indicators. They determine the health status of a population. Example, the diet of that population, smoking, the water quality, income, access to the health services. That is nothing but the economy. How well settled or how accessible it is, how developed the country is, what is the economic position, the social status of that population will determine the health determinant indicator it is. Now let us see the next slide. What are the uses of these indicators of health? What do? They will measure the health of the community. Very well, by now we have understood they measure the health status of the community. They give a description of the health of the community by indicate. Now when you look into the life expectancy, you see that people are living for a longer years, which means that the health services provided to the community are good. People are availing the good services. They are having the capacity to assess the health services which are being provided, which is giving the description of the health of the community. It also helps in the comparison of the health of the different communities. Now let us see, in a developed country, and this is an underdeveloped country or developing country. In the developed countries, what happens? The life expectancy will be high, the economical status will be good, so the health services will be good and the life expectancy will be good. Whereas here in the developing countries or underdeveloped countries, poverty prevails in them, the lower socio-economic class, in them what happens? The life expectancy is low because they cannot access the health services. So it also helps in comparing the health of the different communities. These indicators also help in the identification of the health needs. So by this we get to know in the rural areas we need to set up the hospitalities. We don't usually find emergency casualties and so on in the rural areas. So it helps in the identification of the health needs and by prioritizing them, and it also prioritizes them what is the most needed thing for right now in the community, which will be can be found out by this indicators. The classification of indicators. Now we are moving on to the core of the subject, the main thing of this topic, indicators of health, is these indicators. You need to be thorough with these indicators. Now let us go on with each of them. We have mortality indicator, morbidity. See now what is the difference? Mortality is nothing but the death. What do you mean by morbidity? Morbidity is the disease. Disability, nutritional status, nutritional indicator, healthcare delivery indicator, health policy indicator, and then utilization rates, indicators of social and mental health, environmental indicators, socio-economic indicators. All these together you can remember: environmental, socio-economic, indicators of quality of life. So guys, I'll just repeat it again. So what are the indicators? They are mortality, morbidity, disability, death, disease, and disability. Because of the disease the person was disabled. This is how you can remember. See, either it ends up in death or the disease can lead to disability. So we have mortality, morbidity, disability. Now nutritional indicator, healthcare delivery, health policy. So these three you can remember: nutritional, healthcare, health policy. So now how you are utilizing the health policy indicator? Utilization. So there is healthcare delivery, there is health policy. How well the utilization is there? So guys, how can you remember? The first three you can remember: mortality, morbidity, disability. Then we move on, the nutrition, healthcare delivery, health policy. And how is the utilization of all of these you can remember. And then social and mental health, environmental health, socio-economic. So social, two words you can remember here: social and mental, socio-economic, these two together. Then comes the environment, quality of life, and other indicators. Environment indicators, quality of life, and other indicators. Moving on, each one of them we're gonna deal in detail in the upcoming slides, starting off with the mortality indicator. So what did I tell by mortality? Mortality is what? Mortality is the death. So what does this indicate? What are the various things which fall under the mortality indicator? We have crude death rate, age specific death rate, infant mortality, child mortality, under 5 proportionate mortality rate, adult mortality rate, maternal or puerperal mortality rate. So guys, you see here, crude death rate we'll deal here. Next slides, age specific. Now you can remember all of these together. How can we remember this? Infant is less than 1 year. The child, and then comes the under 5. The child is nothing but under 5. Then we have adult and maternal, adult. The person becomes an adult, then becomes the mother. So she was an infant, a girl. Infant was born, and then a child, and then she was a child, then she turned into an adult, and again she became the mother. So this is how you can remember. Crude and age specific, then comes infant, child, under 5, adult, maternal. Moving on, we have disease specific, proportional mortality rate, and case fatality rate. So we see case fatality rate means that is the capacity to cause death in the people. This particular disease, X disease or Y disease or Z disease, what is the capacity of this disease to cause the death? For example, the cancer has a high capacity. Let us take breast cancer. So breast cancer, or we can take any of the cancers, uterine cancers or whatever, the death ratio will be, case fatality of cancer will be high. Whereas in the other case, for example, we have some hemorrhoids. So the hemorrhoids, the case fatality will be low. So this is what they mean by case fatality rate. Proportional mortality rate will deal in detail disease specific. For now you remember the names: disease specific, proportional mortality, case fatality. In detail, so don't forget guys, under mortality rate, mortality indicators, we have 10 of them which we are dealing in detail. So starting off with crude death rate. So what do you mean by crude death rate? Crude death rate is defined as the number of deaths per 1,000 population per year in a given community. So guys, always remember the denominator is the mid population of that year. So crude is nothing but the number of deaths per 1,000 population per year. Here crude, what do you mean by crude here? In general they are taking, they are not specifying whether it is an infant, whether it is a maternal death or a age is not being specified here, gender is not specified, it is just the total number of deaths per 1,000 population. How much population is considered here? Per 1,000 population in a given community. It indicates the rate at which the people are dying. In many countries, the crude death rate is the only available indicator of health. Very simple is the formula. Crude death rate is what? The number of deaths which are taking place during the year divided by mid-year population of the same place and time. For example, the total number of births which took place, the mid-year population of that area or that community was 1,50,000. The number of deaths is 1,400. So, into 1,000, because you're considering 1,000 population per year, it gives 9.3% 1,000 population per year were dying. 9.3 per 1,000 population per year. It's not given in percentage, I'm sorry. It is 9.3 per 1,000 population per year. Expectation of life. Now we are moving on to life expectancy or expectation of life. Life expectancy at birth is the average number of years that will be lived by those born alive. So we know guys, what is the life expectancy, which is nothing but how many years a person is going to be alive. How much do you expect? For example, in India, like 70 years. Back then it was much less, and now because of it was just 50. After crossing 50, people used to, very long back the health status was too good, but I'm speaking about the recent few years, even before the health services of India was being improved to a greater extent. Now the health has improved and the life expectancy has increased. Here they mean that the average number of years that the person is being living in this world. Life expectancy is the average number of years that will be lived by those who are born alive into a population. So obviously the person will be born alive if the current age specific mortality rate is persisting. Life expectancy at birth is highly influenced by the infant mortality rate. Life expectancy, it is a good indicator of the socio-economic development in the general. So we see that if the life expectancy of the people is increasing, it means that the socio-economic condition of the country is increasing. People are having a good socio-economic condition, so the availing of the health services is good. As a result, the life expectancy is increasing. Age specific death rate. Moving on to the third one, age specific. By the term itself, you know that it is the total number of deaths occurring in a specific age group. It could be any age group, 10 to 20, 20 to 30, 12 to 14. So any age group people, the total number of deaths which are occurring divided by mid-year population of the same age group into 1000 as usual. Now let us see what the definition says. It is the total number of deaths which are occurring in a specific age group of a population. Example, they have taken of 20 to 24 years. So they have taken 20 to 24 years example here. In an area during a specific period per 1000 estimated, how much you are considering? Per 1000 estimated total population of the same age group. Of the same age group per 1000 population is what you are considering, like in we saw earlier. So guys, always remember the formula. The formula is very important. Once you know the formula, the same thing you have to just put it in the form of words. It is defined as the total number of deaths which are occurring in a specific age group, example 20 to 24 years during a specific period, because the same age group you are considering during a specific period per 1000 estimated, per 1000. See, it is nothing but you said the whole thing and then per 1000 estimated total population of the same age group. Simple guys. The definition, don't go with this, it's kind of scary looking at this definition. You're like, oh my god, I need to remember all of these, I don't know how I'm going to remember, it's so confusing and all. Just don't go with all of this. Just see this total number of deaths in a specific age group, simple, by mid-year population of same age group into 1000. Put the same thing in the word format. Moving on, infant mortality rate. Now let us see what infant mortality rate deals with. Infant mortality rate is the total infant deaths divided by the total live births in that specific period into 1000. So let us see, infant mortality rate is the ratio of deaths under 1 year of age. So we know very clearly infant is less than 1 year. So before the first birthday of the baby, 9 months, 8 months, 6 months, 5 months, whatever it is. So before 1 year of age, before celebrating the birthday of the baby and the baby being born, that period is the infancy. So the deaths which are occurring under the 1 year of age in a given year to the total number of live births in the same year. So you see here, it is in given year, in the same year you're considering. We don't want, now we are considering 2023. So now we are considering the total infant deaths of that year divided by total number of the births which occurred in 2023 per 1000 population. So we see here expressed at the rate of 1000 live births. Cool. Next, the child death rate. Child is what? Under 5 kid. Okay, 1 to 4 years. This is very important. When you define child death rate, you need to know the infant less than 1, child 1 to 4 is what you have to know. It is the number of deaths, that is the total death of 1 to 4 years child divided by mid-year population of 1 to 4 years, that is the total population of 1 to 4 years mid-year population expressed in the form of 1000. So it is the number of deaths at the age of 1 to 4 years in a given year per 1000 children in that age group at the midpoint of the year concerned. So same thing guys, the number of deaths of ages 1 to 4 years in a given year. Cool. This is done. Per 1000 children, okay, of that age group in the mid-year population of 1 to 4 years. Clear. Moving on, we have under 5 proportionate mortality rate. So what do they mean by under 5 years? It means the proportion of total deaths which are occurring in the under 5 age group. The rate can be used to reflect both infant, so under 5 includes both infant as well as the child mortality rate. In communities with a poor hygiene, the proportion is exceeding 60 per 1000 live birth. Out of the 1000 children, 60 children unfortunately are dead because of the poor hygiene in the poor communities. Moving on to the adult mortality rate. We have come to the next slide, adult. So what is an adult? Adult is the age of 15 to 60 years per 1000. It is again the same. It is the probability of dying between the age group of 15 to 60 years per 1000 population. How much you are considering? 1000 population. Again divided by mid-year population of the same age group of that community. By now you know to frame the formulas on your own, right guys? Moving on to maternal or puerperal mortality rate. What would you say? It is the proportion of deaths among the women of reproductive age group. Now you consider a particular community of that same age group, the same age group people, the total number of mothers, let's just take a random number 1000, okay? The total number of deaths, let us not take 1000 because we'll be expressing at the rate of 1000. Let us consider the total number of women pregnant were 1.5k and the women dead are 60 into 1000. So we see it is the proportion of deaths among the women of the reproductive age group. So clear guys. Now we move on to the disease specific mortality rate. Disease specific. So I explained about this one particular disease specific, the number of deaths which are occurring because of this disease. The disease 1, the number of deaths is 2. Disease 2, the number of deaths are 80. So we see the disease specific death rate. Communicable diseases, a number of other indicators such as deaths from cancer, cardiovascular diseases, accidents, diabetes, etc. have emerged as a measure of disease specific problems. Disease specific mortality rate is the death from a specific disease by the mid-year population expressed in the term of 1000. Clear guys? The same formula everywhere implies. Only thing is you have to remember disease specific. So the deaths from a specific disease by mid-year population of that period of that year into 1000. Proportional mortality rate. So something proportional. So they are speaking about proportional mortality rate, the simplest measure of estimating the burden of a disease. It is similar to the disease specific. For example, now let us consider cardiovascular diseases. Okay, the burden of cardiovascular diseases, the burden of a disease in the community is the proportional mortality rate. That is the proportion of all the deaths currently attributed to it. So now let us see the total number of deaths in that community were 2000. The deaths from a specific disease because of the cardiovascular diseases, 50 people out of the 2000. The others were attributed to accidents and cancer and so many other respiratory, GIT, female. Let us remove all of them. only cardiovascular let us consider. So it is giving the proportional mortality. How much does this cardiovascular, what is the burden of this cardiovascular disease in causing the death of the community? So it is the burden of a disease in the community is the proportional mortality rate. The proportion of all the deaths currently attributed for it. Example, the coronary heart disease is the cause of 25 to 30% of all the deaths in the Western countries. So they have said a value here for in the Western countries, because of the lifestyle, the sedentary lifestyles, their diet, smoking, alcohol, addictions and all is leading to lots of increase in the cholesterol level and leading to the cardiovascular diseases. Especially the coronary heart diseases is very common in the Western countries, and it is attributing to 25 to 30% of the deaths. So we see that total deaths out of it, how much? 25 to 30% is attributed to cardiovascular diseases. So this is the burden of a disease, what the burden of a disease in the community. Moving on to case fatality rate. Here, case fatality rate, it measures the risk of the persons who are dying from a certain disease within a given time period. Here, the total deaths because of a specific disease by the total number of cases of that specific disease into 100. So guys, you have to remember the formula very well. So see, the deaths because of a specific disease. Okay, cool. The total number of deaths due to that specific disease, fine, into 100. This is the most highlighting factor, into 100, into 100, into 100 in case fatality rate. That is nothing but the killing power of a disease. I told you this thing already in the slide 1. So let's move further without wasting much time. So it is the virulence of the organism. Virulence is nothing but the killing capacity of that organism or the disease. So we are done with the mortality indicators. To recall, we have case fatality rate, proportional mortality rate, disease specific mortality rate. It's better I go from the start. You will get a better clarity. So guys, clear, right? We have crude death rate. Crude is what? The total, in which the total is considered, irrespective of the gender, also the age and everything. Expectation of life, we know that is what is the life expectancy of the individuals in the community. Age specific, in that we have infant, then child, then we saw about under 5, which includes both infant and children, adult, maternal, disease specific, proportional. You have everything you can write. Coming to proportional, you shouldn't be blank. Proportional is nothing but you have to remember the burden of disease in the community. What is the proportion it is holding? This is the proportion. This is the proportion of a particular disease. This is the total number of deaths. Out of this proportion of the death is held by this particular disease. Okay, proportion is nothing but the burden of the disease, what it is doing on the community. Don't forget guys, the proportional mortality rate. Moving on, we have case fatality rate, and we come to an end of the mortality indicators. Moving on to the morbidity indicators. I guess this video will be done in 2 parts. We will discuss morbidity indicators